started here. I still see people arriving, which is great, but I'm Sean Mannion, along with Yael Bizoudi. Would you like to introduce yourself first, and then I'll give my background a little bit, and then we'll talk about the book.
Sure. Hi, everyone. Nice to see some of you again, I guess. Hi, Sean. Hi, Tiffany. Hi, Heather. I'm Yael Bizoudi Kennedy. I'm the co-author of the amazing book, Blockchain for Medical Research, Accelerating Trust in Healthcare here. We received our author copies last week, so very happy about that, finally. I'm a journalist by trade, and I've been writing about blockchain for the past 3-4 years. And that's how I met Sean.
Sean Mannion. I also co-authored this book, and we Blockchain for Medical Research, Accelerating Trust in Healthcare. We had a great time doing it. I'm a neuroscientist by training. I moved into research administration for the federal government for almost a decade, and then I got the blockchain bug in 2016, and I started exploring what could be done with it. Moved out of the federal government, and on the industry side, I'm now the chief scientific officer at Consensus Health. While we wrote this book primarily in 2019 and got to interview a number of people across the fields of health and tech, we put it together, and it takes a lot to publish these things, and our publisher CRC Press did a fine job putting it together, but then it was set to launch at the end of March, and of course everything changed just a little bit. But we also had written a book that was almost predicting what was needed throughout healthcare and research, not just ourselves, but those people we had interviewed. So as Yael said, we didn't actually receive the physical copies of our own book because of the COVID pandemic until just last week. It disrupted our lives in a lot of different ways. Sometimes disruption is a bad thing, but sometimes there's a silver lining, and the disruption itself to healthcare and research has opened up the opportunity to use some of the technology we discussed and described in a way that we probably couldn't have for another 5 to 10 years. And so we decided that revisiting the book and re-interviewing some of those brilliant minds that we had talked to would be a great way to sort of revisit it in the new reality and take these ideas that had been collected from a variety of sources and then put together with our voice and say, hey, how does this now look not in 2019, but in 2020 with all of its weirdness? I think there's a lot to be unpacked here, and we're hopefully going to be able to have a series of these. We had a great conversation with some folks last week, and this week we are going to be able to talk to Heather Flannery and Dr. Tiffany Gray. Just as sort of an orientation, the book itself covers what blockchain is, where it's being utilized, and then how it can be brought into research setting. But it also talks about research and what that is for the people from a technical background who might not understand what medical research is, where it's helpful, where it's challenging. And Yael was great from a journalist perspective to help me do that in a very accessible way. We didn't want this to be technical from a computer sense. We didn't want this to be technical from a medical research sense. We wanted it to be approachable for all individuals. And then we took the ideas that a lot of the people we interviewed had discussed, and I knew, and we had met in a lot of different contexts, and we wove them into what we see as what can be done with this technology in the long term, and now probably in the midterm with respect to medical research. Where each week we're talking to a few different people, and we're looking at different aspects of the book. Today we really want to look at not specifically medical research or the background on the nuts and bolts of blockchain, but on what the chapter is called Beyond Bitcoin, which is looking at some of the applications that we're starting to see in healthcare. And in late 2019, when we wrapped up the book, that had advanced considerably, given that it hasn't been around in healthcare very long. Now, really just 9 months later, it's tremendously further along. And I think what we're seeing is, it's advancing in some of the administrative and financial and acquisitional applications. The Accelerate program that was set up at Health and Human Services is now live and running and saving hundreds of millions or tens of millions of dollars, but has also inspired some other changes that are coming down the pike at HHS. And we hope to talk to Jose Arrieta in the future about those. But across industry, there's been a tremendous amount of advancement in what this can do in a lot of different areas. And there's been also a lot of advancement happening in the past few months. We at Consensus Health were able to have a hackathon where we explored applications of blockchain as well as other technologies like artificial intelligence and machine learning applied to different problem sets within the COVID healthcare ecosystem. And we had a lot of discovery there, some early piloting there that has been tremendous. I think some of the other areas that have advanced since last year is in publishing. Artifacts is a company which is working with Blockchain for Healthcare Today and Journal of the British Blockchain Associations to start to integrate this technology into the publishing industry in a way that not immediately, but down the line, will be able to accelerate those findings to the public and that knowledge translation to the public in a way that's secured, in a way that's documentable, in a way that's auditable, that we don't have now, and we kind of wish we have in the current environment. There's been tens of thousands, over 10,000 papers published about COVID since this pandemic started. And there's been some significant challenges with the provenance of the data in those papers, and some false starts and some false announcements that probably shouldn't have made it to the public with that level of reliability, given how unreliable some of the sources were. With this technology, there's tremendous ability to have new looks at how we can have security and reliability to that data and the findings that are presented. So I think publishing is another area that has moved forward a lot. And of course, kind of the holy grail for health and with research is getting the electronic health records to be more accessible, more reliable, to be more shareable in ways that in a public health emergency, you can get the data you need, and the right people, the right researchers, the right physicians can have it at the right time. But there's a lot of other small utility functions of it in supply chain. I think we've seen that across industries, but healthcare is definitely one where applications of blockchain and supply chain are taking off rapidly, and this has only accelerated it, the current pandemic. With that, I think those are some realms that individually we might go into more in the weeks ahead. But today I'd like to now hand it off to our wonderful panel. Because they gave us some great insights on this last year, and they've both been living it over the past 4 or 5 months in their current roles. And so hearing how the world has changed and how that has changed both the challenges and opportunities for blockchain is something that I think will be very valuable. So I'll hand it off to Yael to kick off the panel. Thank you.
Great, thanks, Sean. So thanks again, Tiffany and Heather, for being here today. So first of all, could you please briefly introduce yourself and tell us a little bit about what has changed for you in the past year? Heather, if you want to start.
Sure, happy to. It's an honor to be here with you, Yael, and Drs. Mannion and Gray. I'm Heather Flannery. I am the founder and chief executive officer of Consensus Health. I also am a passionate advocate for the development of standards in healthcare and life sciences, and I chair a standards development working group at IEEE with that focus. And I'm honored to co-chair the blockchain task force at the Health Information Management Systems Society, or HIMSS. The last year has been very interesting. In my role, we restructured Consensus Health into an independent entity effective the 2nd of March. I'm sure everyone on the line remembers what was going on right around the 2nd of March in the United States. So it was a very interesting time to launch a health information technology product kind of company, while at the same time working with my direct competitors and collaborators to come together on standards that would allow us to move forward. The overarching profound feeling is one of, if only we were doing everything we're doing right now about 2 or 3 years ago. And the if onlys don't get us that far, but the sense of having lost time and the sadness at the consequences of having lost that time. Why did we lose it? There's no one party to blame. Simply the absence of a collective sense of urgency to transform the industry at its foundations. And I also will blame a habitual attachment to incrementalism in our industry. Oh, the really systemic structural interventions, that's too hard. So let's just pick some tiny little thing and we'll work on some tiny little problem and then we'll celebrate ourselves. with respect to that tiny little problem. And that is an intellectual crutch and a method of global procrastination. And it hit us so hard and so tragically in this pandemic globally. So unfortunately, there is no way to take all of the work that we've been striving to do and turn it around inside of 45 days or something to that effect. But the biggest difference that I see that is a silver lining, that is a hopeful and positive way of thinking about this, is that the vulnerabilities in our system have been laid bare. They have been made plain. The attitude of indefinite procrastination about the hardest problems in our industry has lifted. And I think all stakeholder groups have a radically accelerated sense of urgency, even if we don't have alignment on how we ought to go about solving these problems precisely, because they're very tough. There is an attitudinal shift, and I am thankful for that. And I'll leave that there and turn it over to Dr. Gray.
Hello, everyone. Good afternoon, and thank you for having me. I'm Dr. Tiffany Gray. I am a public health advisor with the DC Department of Health. I am currently, I guess how things have changed within a year for myself, I am currently working as part of the COVID-19 response for the district, helping to lead the contact tracing efforts, specifically around training, and more recently developing some protocols and program implementation proposals around home visitation as part of contact tracing. I state that, you know, all opinions, ideas are my own. I don't speak for the agency. But as you know, Heather has mentioned, in addition, I also serve as a Blockchain in Healthcare Global Fellow alongside Dr. Mannion and Heather Flannery as well, and help to co-chair the research subgroup as well for Blockchain in Healthcare Global. In addition, a recent Patientory Inc. ambassador as well. So again, as Heather mentioned, you know, we are in a rapid state of change. Things change daily, even in my current role as a public health advisor with the Department of Health. Things are happening at a quick and rapid pace as we try to keep up and try to get ahead of the response and ensuring that we are, you know, keeping the safety and health of individuals in our population as a priority. So we definitely have a lot of competing, you know, other barriers and challenges when it comes to our implementation of our strategy. But it also definitely involves a collective effort working with our hospital care system, our clinics, our local organizations to be able to provide effective resources and provide the care that's needed for individuals, and to ensure that our city and you know, are able to stay safe and prosper economically as well. But it, you know, it's a long road. We stated that there's just sort of no end in sight, but there is a lot of promise. And we've seen a lot of advancement in a lot of strategies and thinking about various strategies that can be implemented, whether it be for data collection and ensuring a certain level of transparency and improving transparency, you know, in our public health fight and efforts. So.
Fantastic. Thanks so much for introducing yourselves. So, Dr. Gray, I'm going to start with you. So in our book, in the particular chapter we're addressing today, From Finance to Health, Way Beyond Bitcoin, we argue that, I mean, we state that while blockchain became known first in the finance world, because usually that's where change happens faster, applications in healthcare varied, including electronic health records, research, pharma tracking, supply chain, etc. So when I interviewed you for the book, you said that in healthcare, at the end of the day, it's about improving health outcomes of populations. So to improve the way to help people, it's important to include end users, the patients. So it can be conversations about ease of use, language, literacy, etc. Can you elaborate a little bit on that and explain, you know,
Sure.
put it in context today?
You know, I think it's essentially when I say that, I just meant that as we see with a lot of various areas, even outside of healthcare, that it's really important to ensure that the individuals who we are aiming to reach with these emerging technologies, to bring those individuals to the table. Because as patients, there are certain barriers and challenges that necessarily don't show themselves in the data, or they don't show themselves in the technology. And if we are to ensure that the technology that we're utilizing to help people, we want to make sure that it's actually having the impact and outcomes that we expect to see. We want to see improved health. We want to see that by sharing electronic health records or being able to integrate these systems better within healthcare, that they have a long-standing impact on what we're seeing in reduction of cost of care, improving access to care. So I could use the example of COVID, for example, whether it's being able to identify and trace at a faster rate, making sure that we're able to follow up with contacts, make sure that we're able to reach those in areas that we can't always get to, or that may be harder hit, for example. So just essentially, it's that we need to ensure that these individuals are being brought to the table, that we make sure that, you know, the language is accessible, you know, terms that are being used are accessible to the end user. And essentially, just again, as we, you know, especially in public health and as public practitioners and researchers, we are often faced with, you know, data and stats, and we use that to guide how we make changes or implement certain types of technology, but it may not necessarily be the best approach. And so by having individuals who we are using or planning to incorporate or use this technology with, again, the patients, communities at the population level, we can have those open dialogues and open conversations to identify what are potential pain points that we on the other side don't necessarily see. And so that is a very important component when we're thinking about blockchain and blockchain technology. It's the same thing when we're thinking about research. You want to involve the individuals. And it's not very different than from, say, if we're thinking about like advertisement or finance, you know, in the financial world, you do your focus groups, you collect your data. That's important, but it's an ongoing process, and it needs to continue to happen, and not just at one point, not just at the beginning, but it is an ongoing process that needs to take place.
Heather, anything you want to add?
Sure. So strong concurrence with Dr. Gray, and I think I would add that the principles of patient-centeredness have informed a huge amount of health policy and public health interventions and clinical strategies. And it's important to point out that despite those strong intentions and a lot of discussion about patient-centeredness, that still frankly eludes our industry. And authentically, we do not have a patient-centered system despite our striving, though we've made great progress in various areas. I mean, there's certainly progress, but as we look at the use or the rolling out of a set of emerging technologies, we need to make sure that the deployment of those new technologies don't widen the digital divide. You know, Web 2 that brought with it you know, cloud-based EHRs and brought with it mobile health applications and digital therapeutics, and that whole wave of Web 2 technologies has skipped over large portions of the population. And earlier when I was saying how the pandemic has laid bare our system's vulnerabilities, you know, those patients who had access to digital health technologies, that means smart devices in their hands, plenty of connectivity, and the health and technical literacy to be able to effectively engage with those technologies, have had a very dramatically different experience in this pandemic than those parties without access to that technology. And that's not just blockchain. That's our culture is now dependent. We are digitally interconnected. It already happened. It snuck up on us. We are dependent on this technology, but the pandemic showed us how much our culture has changed and how critical it is that we don't think of digital health strategies as being nice to haves or luxuries any longer.
Great, thank you. Yeah,
Oh,
go
so
ahead.
Do you agree? Curious. Do you agree?
I definitely agree. And you know, again, it goes back to that point again of the importance of diversity and inclusion, and I think it's a buzzword, and it's talked about in many different aspects outside of healthcare as well. But they, you know, again, it's as we've had to in the time of COVID, had to move and shift to this telehealth delivery method of having, you know, access to healthcare. You know, Heather makes a great point again of, you know, it's only widening the gap. And I think that also touches on something that we'll touch upon later on in this discussion of the importance that the reason we want to make sure that we're including the end user and including these various communities and populations in these discussions is so that we, again, aren't continuing to widen health disparities and exacerbate the issues further.
Yes, and actually on that point, Dr. Gray, when another interesting point you made when I interviewed you last year is that you said we want to make sure that the technologies and what we do with them don't further increase disparities within populations. And people have raised concerns with AI about racism, discrimination, and cause those kinds of problems. So we had to make sure we don't create new disparities. So for example, you were mentioning telehealth, and users tend to be more educated and have access or easier access, and et cetera. So we want to make sure we engage them more, we teach them more, et cetera. And public health needs to be the key component. So can you elaborate a little bit more on that, especially in light of the past few months, not only the pandemic, but the social events in America and across the world?
Again, we're seeing, as I think Heather and I have both mentioned, is we are seeing firsthand the impact that you know, these existing gaps are having. Right, we are seeing firsthand the challenges and existing barriers that sort of exist outside of technology, and that includes policy. You know, policy is a key piece, and even just sort of the availability of resources, right? And so one of the other things is access, and we see that those who have access are able to sort of, you know, get tested sooner, are able to get follow-up care sooner. We are seeing, you know, one of the main drivers or factors behind, you know, increased cases are especially early on in the pandemic, were those individuals who couldn't take off work, right? And those were in communities of color. And it's important that we take those things into consideration because as we go to develop out new technologies or we think about access, you know, it's sometimes it's a lot bigger. Like there are just some systemic issues that we definitely need to address and make sure that even as advocates of blockchain or advocates of emerging technology, that we also include those pieces as part of the conversation, and that we advocate on behalf of these patients, and that we advocate on behalf of these communities and populations. Because much like with the conversations around cryptocurrency or Bitcoin, et cetera, it's, yes, digital dollar or digital currency is sort of the new way. It's going to, you know, help improve access. But it's ensuring that we also address things like health literacy. It's ensuring that we address and have conversations about, you know, health literacy and how to access, how to navigate healthcare systems and how to advocate for yourself as a patient. Like, these things are not separate. They are still part of all the things that underlie or that are underlying what we all are trying to essentially achieve. So it's again, also when we think about ensuring adequate availability of language access, right? And not just health literacy, but also language resources, for example, as we, again, diversity, think about diversity at all levels and in all components. And again, it's just, we just need to ensure that we are taking these things into consideration and that we are, you know, making note of them. So again, we don't want to end up creating additional problems, right? And when we talk about, for example, AI, and, you know, when we're developing these, making sure that we're talking to individuals so that, you know, we as public health practitioners, we as healthcare workers and researchers, we all sort of have our sets of biases, and it's you know, implicit biases that are based on, again, the information that we are into every day. We're into the numbers, we're into the quantitative side of things, and they tell one part of the story. And so we take that one part of the story and use that to then develop, oh, the system needs to ask this set of questions, or it needs to gather this particular, you know, piece of information, when there may be things that are missing and things that we don't necessarily see. And that's why it's, again, going back to the initial question, end quote, of why we need to ensure that we have various people at the table to really ask, well, what is your experience? You know, if, you know, what does this feel like for you? What makes this difficult for you? What would make this easier for you? What would make you more likely to utilize this technology? And then again, the biggest thing is trust, right? There's a long-standing history of just trust and mistrust within science and health and research. We see it still to this day, whether we're talking about maternal and child health and maternal health disparities that we see in women of color, when it comes to COVID and the COVID response, the huge disparities in communities of colors and the rates at which individuals are dying from COVID. One of the, you know, the contributing risk factors of you know, being at risk for COVID, again, chronic disease, for example, you know, these are things that are long-standing health issues that aren't necessarily going to be solved by an application, aren't necessarily going to be solved by even just being able to improve, you know, interoperability or working through EHR, but they are things that when we are building out these technologies and we're thinking about developing the policies around these technologies, or when we're thinking about creating the standards around these technologies, these are the key components and these are the key factors that we need to keep in mind, because if we don't take them into consideration at the very beginning and we wait too late, which we see happening all the time and way too frequently, then we turn around and say it's too late, and then we've lost time, and then we have to backtrack. And then again, at that point, we've already created sort of this ongoing systemic issue and ongoing systemic disparities.
Heather, anything you want to add?
I think, Dr. Gray, that was very eloquently articulated. I just fully agree. And I would suggest that anybody who thinks they can build a whiz-bang piece of software, I don't care whether it's decentralized or not, if they think that the answer to healthcare and life sciences problems lives by developing and then putting in market a software product, that is such a gross oversimplification of what our industry actually needs and what a patient-centered approach really requires. So when we get to the blockchain portion of the program, more important than the technology is the fact that it enables experimental new business models, new structures. And ethically, we need to think of those as experimental, and we need to use classic empirical methods and thinking to assess the degree to which these new structures, perhaps that introduce different ways of incentivizing stakeholder groups, we can hypothesize that they'll have an effect, but we shouldn't also be making claims that the technology will do this or it'll do that. It's not going to do anything. New business models that are implemented, that are carefully studied and assessed and iterated on, that, you know, may have dependencies on the technology, that has potential. That has reason for hopefulness. But yeah, a technology independent of structural and systemic kinds of changes won't be enough. Maybe necessary, but not sufficient.
Thank you. I could go on and on that topic. It's fascinating. But anyway, switching gears a little bit, Heather. So when I interviewed you last year, we were talking about the barriers to adoption, and you said that compliance ambiguity was a major barrier in areas of policy, regulation across jurisdictions around the world, the immaturity of technical standards, and the absence of any certification to conformity to standards. Can you explain what you mean by that? And do you think things have changed since I interviewed you and since the pandemic happened?
There have been some changes since that interview. In the US market, the final set of rules for the implementation of the 21st Century Cures Act anti-information blocking provisions have now been released. At the time of that interview, it was something I might have mentioned, but it was still out in the future. We were waiting. There's a lot of debate going on. Or the liquidity and portability of health information in the US, that's a major revolutionary change. And it opens the door to patient-mediated exchange being feasible at scale, which by patient-mediated exchange, I mean, you're still talking about an enterprise-to-enterprise data transfer, but the consent and the triggering of the workflow is moves through an individual patient. There's another possibility that goes beyond patient mediation to patient sovereign, in which case a patient takes custody of a set of information, at which point it's governed under a separate set of terms and a separate set of legalities, and then the patient themselves can move their information. And then there's a third dimension where that patient sovereign information can remain at rest, and what a patient can consent to is an analysis being performed on site and only the results of an analysis being shared outbound. So I would think of that as 3 stages of available value creation for using health information that were basically, for all intents and purposes, out of reach at any scale. And that is now all made possible, though not mandated, by the anti-information blocking provisions. That further leans in on a particular data standard called FHIR, and provides specificity about the structure in which that data needs to move around. And that, while that is not a panacea, doesn't solve every problem in our industry, it's a core enabler and a policy that I'm very pleased to see has moved, closer to the finish line. We still haven't hit the effective dates. Also, since that time, the cultural ethos with respect to privacy has continued to shift. What I would say initiated with the General Data Protection Rule and then was further instantiated by the CCPA in California, that increasingly our culture generally, not specific to healthcare, is more aware of the importance of inherent human data and how it is monetized by various categories of businesses, and the right to receive a copy of information about you. And I don't mean EHR data, I mean Amex, Netflix, anybody, anyone who is maintaining information about you, you have a right to receive a copy of that. And that opens the door for things like self-sovereign AI, for example, to be able to use that information for the aims and agenda of individuals versus solely for the aims and purposes of enterprises and governments, which is the only party that has access to that kind of technology today. If you're not a large enterprise or a government, you're not able to take advantage of that. So there's in the pandemic, I think there has been, we have had throughout human history, there has been tension between freedom and security. And this lives mostly in the political science realm and different systems of government over time. And everyone wants to be safe and everyone wants to be free. And those are often conflicting. Government use of force tends to elicit very strong negative reactions from a freedom-loving population. And the public health authority under the law in the United States is one of the few very clear sets of legal authorities for the government to use force. And I think that you cannot disconnect the semi-conscious implications of everything else that has gone on around the inappropriate and revolting uses of force on behalf of police departments. But at the same time, we also have the exercising of power in the public health authority going on that I think just raises everyone's concerns. I think that this family of technologies, and that not just blockchain, but also zero knowledge cryptography and some other converging innovations, we have the chance, we have the possibility to resolve that tension between privacy and security. And that so far, it's everybody's still pulling on one side or another of the tug of war rope. And I'm saying that I think we can actually just lay the rope down, because the technology can enable us to meet the needs of both public health authorities and privacy and freedom-loving individuals. And that we can have both, we can do both. But it's with new technologies that our culture barely even understands exists at all. So it's distant, because our world has to understand that that's possible before they could ever advocate for it. People aren't going to advocate for something they don't even know is possible. So that's a real challenge that we have here, is if people won't get behind an agenda that they don't even think is realistic or achievable. So I don't know, I'm curious what you think about that, Dr. Gray. You've been very close to technology for a while, and wondering.
Yeah. I definitely, I think that last point, it definitely hits sort of the nail on the head, and can even be tied into sort of our current efforts now, right? So again, it's everyone. I think when you said everyone wants to be safe and free, right? Everyone wants to, we hear that in the ongoing conversations, even around, especially in the beginning of the pandemic, of where's the data, where's the data, where's the data? However, it's, I don't want to give you my data. I don't want to give you my data. And so there's that, again, that building sort of that trust of really trying to figure out, okay, how can we really truly get people to understand the importance of, well, this is why we need your information, and we understand, and having that kind of compassion and going to individuals with that of, we understand that there's been these longstanding issues and around trust and being able to ensure that this information is not going to be used in a harmful way, but again, to benefit you. Again, we want to help, but I think that is just one of those things that's just a continuing, ongoing challenge. And again, when we talk about policies and regulations, just ensuring and thinking about the ways that we can really kind of build in those protections, but also make sure that we're still able to keep people safe and healthy. We're running into that issue when it comes to all across the world, well, especially in the US, around contact tracing. And, timing wise, we are in the middle of, again, dealing with issues of police brutality and, misuse of force and information across the board. And then here we come as public health authorities, really trying to get people back to some sense of normal and try to stop the spread of an awful disease. But we're facing and running into those issues of trusting, is this really the DC Department of Health calling my phone? Is this, why are you asking me these because you have to ask some very invasive questions. Why are you asking me all these questions? Why do you need to know all this information? And, figuring out ways to ensure them that we're doing this, again, as much as you are willing to offer us, and anything you can give us at this point is really helpful. But people are afraid. People are afraid that if I give this information to you, I'm going to be deported. I'm going to be separated from my family. I'm going to lose my job, or again, I've got to go. You want me to stay in my home and isolate, but I've got to go out and work. So again, these are, and this is why this again goes back to sort of our initial conversations of why it's really important to always engage individuals, you know, in these types of conversations to really identify, okay, what are your fears and how can we work together to figure out some sort of way that we can, you know, start to build some sort of trust, you know, even again, while we are working to address some of these higher level issues and higher level systemic issues and changing those policies so that, yes, you know, we can provide, if you want this information, this is how you know, can access it. And this is what this could be utilized for. Or providing ways that individuals can say, no, you can't have this portion of information, but you can have this, and etc. So again, I don't, you know, these are conversations that are going to be continuing today, tomorrow, in the next year, in the upcoming years, and shouldn't go away. They should always be ongoing conversations. So again, I think it is a huge challenge and, you know, a continued barrier for us, but it's, you know, important that we continue to highlight it and continue to talk to, you know, individuals from different areas and focus areas to really kind of come up with collective strategies around how we can improve this and how we can, again, build trust and, you know, make sure that people are safe and healthy, but also aren't being, you know, preyed upon as well.
Fantastic, thank you. Heather, on the topic of barrier or challenges, one you mentioned last year when we talked again for the book was the diametric opposition between what industry wants and what investors want to fund. And you said that it was super challenging. And you said,
Awkward. It's a little awkward, just saying.
You were saying that we need to think as blockchain as a new class of utility and the relationship between public and private sectors. And that it has to be viewed, or it should be viewed, as critical infrastructure that underpins whole swaths of the economy. So can you revisit this statement in light of the pandemic and the current economic situation?
Sure, I'd be happy to. This is a really tough one. If you are an investor in a for-profit company, you want to know the return on your investment. And that has to do with financial forecasts that, when dealing with the way emerging technologies will hit complex adaptive systems, are in many ways, they're going to be works of fiction until we're on the other side and we can perform some retrospective analyses and then start to look at prediction and trend lines about where things will head. Let me give you the example. What do investors want? How do I know that your tool, infrastructure, product, widget, whatever, is going to win in the market? Meaning, how is it going to block competition and prevent others from doing the same thing that you're doing? Because then I'll lose my money, right? What does the industry want? The buy side of the industry, not the vendor side of the industry. What they want more than anything else is an absolute guarantee that there will never be any vendor lock-in ever. No more vendor lock-in. It's over forever. Everything will beautifully and seamlessly interoperate with everything else, which means, what does that mean? That means they can pick whatever technology they feel like at any given time, and it'll all work together magically. Meanwhile, all those vendors selling the technology has investors saying, I need you to win. I need you to win. If we don't win, we lose our money. So there's a really foundational problem with the idea of selling these emerging technologies in the form of software sales, or the way that technology products have been sold, let's say in Web 2. And it's that there is a industry says, show me how it interoperates. Show me how I never have to worry that if I don't like you anymore, I can't get away from you. Show me how, no matter what technology I use, it will automatically work with every other technology. And if you can't show me that, I'm just going to wait. I'm going to wait until you guys figure it out, until there's a standard, until you can prove to me that these things will work together and I won't be locked in. And a big risk in our field. I mean, this is metaphoric, but our entire industry has PTSD over over EHR, everything that's happened with EHRs and the absence of portability of health information, and HIPAA being called the Health Information Portability Prevention Act. That's our friend Mitch Parker. I got that from him. I love that. But we all are, our whole industry is shell-shocked about a giant digital wave that will create just larger silos that don't interoperate, where we don't fix the identity problem, where it's really vendor-driven visions for the future that are structured in a win-lose kind of construct. If somebody wins, somebody else has to lose. And that's that really foundational issue, because if you need to do really large scale, let's call it major works in our industry, which would be building a new class of utility that does not exist, that is person-centered, that meets these needs, that's not a small thing. That's not small ball. That's not seed money. I mean, that's big capital. Well, getting everybody to agree on how it is that you can make money and do good is really not trivial. And all I'm going to say is that I don't think that the construct of selling technology products into our industry is the construct that can work. And instead, you have to have a different kind of business model that enters as a new stakeholder group. And that business model, sure, it uses a bunch of new tech because that's necessary but not sufficient. But that business model isn't selling software, or it's not selling tech per se. It's delivering something new in a person-centered way that does not exist in our industry. I think that could work. But just the idea of building software and putting it in market among the whole constellation of competing pieces of software, it certainly is what policymakers and the buy side of all the transactions are rejecting and saying, stop, I don't want those solutions. Give me interoperability up and down the stack, or I'm just going to wait until you do. I get a little fired up about this, sorry.
Sean, do we have time for last question?
I think so. This has been such a wonderful dialogue. I know there are probably questions from the audience, but they're questions we can tackle in coming weeks as well. And maybe if we have enough, we can bring these guests back. But I think continue, please.
Perfect. All right, so it's a question actually for both of you, Dr. Gray and Heather. Do you think people's perception of blockchain has changed in the past few months? I was going to say the past year, but in the past few months. And do you think that barriers to adoption have been lowered because of the pandemic?
Ooh, that's a good one. I wouldn't say, I think people are still, I think blockchain, again, it's growing and people are becoming more aware of the technology, but I still think we have a ways to go, a long ways to go. So, which again, it's an ongoing process. I don't think, again, I think people may be willing or more willing to accept sort of new strategies centered around utilizing something like blockchain to improve workflow and processes. And again, I think that there will be a push in the next sort of, upcoming year or so for things like that, to sort of speed up processes of, whether it be capturing data and information and transparency of information. But I think there are still barriers in place. And I think the conversations around those barriers and barriers to adoption are increasing and growing. And that's, a very important thing, and will definitely continue.
And Heather?
I think we've lost Heather's connectivity at the moment. I think if you were paying attention, I think we literally watched a storm roll in through her window behind her, because day to night. But by the listing, she froze and seems to be offline. So I think at this point, Randall, if we do have any questions from the audience, particularly if they're for Dr. Gray or general, now would be a great time.
I don't see any questions rolling in. If anyone does have any questions, you can go ahead and leverage the questions function of your GoToWebinar panel. And I just do want to confirm that Heather is down as due to the storm. I'm in a slightly south portion of Northern Virginia that she is, and it's just hitting me. And I can say that I do understand that because it's all heck just broke loose.
That's quite understandable. Well, while our audience comes up with questions, if they have them, I'm going to ask a question because I like research, and so I'm going to focus things back on research as always. And Tiffany, you brought up one point with respect to having trust in science and having trust in the research, and I think that that's something that we almost assume is a given, but it really isn't. And I think that those groups, those communities that have more trust in science are more willing to hand over their data to scientists, and then you get science about those groups rather than science about people by and large. Sometimes it's a trust issue, sometimes it's an access issue, sometimes it's a focus or a funding issue. All of these things come into play. In increasing the trust in particular, how do you see this technology helping, and how do you see the incentivization aspects playing a part in that building trust with respect to research and individuals allowing their data to be used for research?
I think that's when we talked about barriers to adoption. It's an ongoing challenge, right? And I think as we mentioned, this is why sort of those conversations around their technology and communicating and educating various communities about it are important from the beginning, because again, it's about trying to figure out how to build that before you build the tech, right? Because if not, then again we're kind of back at square one. So I think, and again, one of the challenges, I think I always say that the more that we begin to get more sort of case studies, as we begin to see, as we've seen over the last year or two, we have, for example, the blockchain pilots through FDA, for example, and with supply chain and within medicine and within healthcare. I think when we start getting some more of those sort of concrete examples and showing individuals, well, this is how this can be used, this is how this technology is implemented, and this is what it means for you and your health and your well-being, this is how this could benefit you, is always important as a sort of first step to sort of trying to build in some trust among various populations and community. And you brought a great point again of how a lot of times when we're building out the tech, those who are aware of the technology or aware of science or more willing to participate, again, that data gets entered and then we build on that data. And so and then again, that starts that kind of ripple effect of again, systemic issues and systemic challenges and discrimination down the line. And again, outside of, again, we see it with, the potential for, we can use the case of development of a vaccine for COVID and, the need for individuals from diverse backgrounds to be part of those trials. And we're lacking in that, and that's going to have an impact down the line if and when we get a vaccine. And so it's important not to wait when a vaccine is developed to start having these conversations, but in public health, we need to start having these conversations early on of what this means and what this means for you and your family. Let's gather information on what are your concerns about, getting a vaccine or the harms or potential harms, etc. And again, we're dealing with difficult times and difficult administration, I guess, is that the PC way of saying things, but, we have some policy barriers and roadblocks that are, going to impact that. And again, those things trickle down into, again, when we're trying to build sort of trust around some of these emerging technologies and blockchain to be used in research, used in academia, used in federal government, etc. I think the incentivization side may also, it can help open the door around the conversations. Again, when we're talking about trying to, show the benefits or the potential benefits to individuals. And I think it goes back to also sort of what Heather was speaking to about, even on the investment side, right? People want to know, how is my investment? How is this going to, come back to me, or how is this going to be of use to me? And I think if we go in with that mindset of always thinking about how can we communicate how this technology is going to be of use and benefit to individuals, and also being transparent about the things that we don't know. I think that's also important, of being very transparent and being very upfront from the beginning of, this is what we know, and this is what we've been able to see, and that there's, still a lot of way to go, and this is what we're hoping for. But in order to get there, this is where you can be of benefit, and this is where your input is valuable. And I think when people feel as if they have, the ability to provide some insight, or to be able to provide input, and that they're being listened to, and that they can see that they're being listened to, or that their needs or concerns are being implemented when we're testing things out, or as we're making changes. I think that's one strategy, and one way that we can start to build and open up trust for use.
Excellent, excellent. And we're bumping up against time, or I'd like to delve into incentivization on the other side, incentivizing more people to be involved in science and research. But that'll be a future discussion for us. At this point, I'm gonna give Yael the last word. Thank you, Dr. Gray, and she will. Yael, can you send us off, please?
Yes, thanks so much, Dr. Gray. Thanks, Heather, or Randall. Tell her I say thanks. And thank you everyone for joining us today. And hopefully we'll have a next session next week. And we hope to see you there. And get our book if you haven't gotten it, available CRC Press, Barnes & Noble. So yeah, thank you everyone. See you next week.
Thank you.
Bye-bye.
Bye.